Happy Monday. Hope your week has started out beautiful. Today we're going to be talking about a common condition that many of our patients as well as you deal with, and that's carpal tunnel syndrome. So carpal tunnel can happen from a variety of different things. It can happen from poor posture. It can happen from repetitive movements. It can happen from a variety of different ways, even just swelling in your body, not having to do with anything dealing with either posture or repetitive movements. But before we get started, go to modomamassage.com to get started with your introductory massage package. We would love to help you out, and I'll mention it again at the end of this live. But today we are talking about massage for carpal tunnel. So carpal tunnel affects millions of Americans nationwide, and it costs companies billions of dollars in insurance and workers' compensation claims each year. A typical recovery plan involves corrective surgery, but there's also non-invasive ways that you can find solutions for your carpal tunnel, including massage. So what carpal tunnel is caused by is inflammation or entrapment of the median nerves within the carpal tunnel of the inside of the wrist. So if you're feeling numbness, tingling, even some burning, this could be carpal tunnel. Especially in the hand, wrist, and forearm. It may include difficulty grasping. You might lose some strength, and also carrying objects, and the pain might be worse in the evening and may even interrupt your sleep. Carpal tunnel is often associated with long-term repetitive motions or strain, such as working at a computer all day long or an assembly line for hours and hours on end. But genetics also has an equal component in this. Hereditary small carpal tunnels and diseases such as diabetes and rheumatoid arthritis may contribute to the symptoms as well. So what you may not know is that carpal tunnel is often misdiagnosed. Often, a lot of times, people actually have thoracic outlet syndrome. Thoracic outlet syndrome is also caused by nerve entrapment with the same symptoms of pain, numbness and tingling in the hands, thumb, wrist, and forearm. But the nerve impingement is higher up in the neck and also in the shoulder region. So could require a completely different set of solutions and treatment to relieve pain. So no matter who you're seeking treatment from, the provider should be aware of how to treat both of these types of conditions. So if you're just seeking typical medical treatment, non-holistic, then the cost of carpal tunnel treatment can get pretty pricey. You're probably going to be prescribed wrist splints, which immobilize the wrist and ease pressure on the tendons, which might reduce swelling and inflammation. But these splints range in price from either $15 up to $120. I personally had a time where I struggled with carpal tunnel. Mine were, for a set, were $135. So they can be pricey, and they only temporarily reduce the pain. They don't solve it. They don't get to the solution of it. Carpal tunnel surgery is the most invasive procedure for this condition, and the success rate is not even high. A surgeon usually will cut away part of the area in your wrist where the impingement is happening, and the cost can be $5,000 or higher for each 30-minute surgical procedure. So that could be $5,000 per wrist. And what's so sad is that so much of the time this doesn't even work. Only 23% of carpal tunnel syndrome patients return to their previous professions after surgery. Up to 36% of all carpal tunnel syndrome patients require unlimited medical treatment. And the surgery has a 57% failure rate following patients from 1 day to 6 years. So at least one of the following symptoms are going to recur, which is pain, numbness, and tingling. So, okay, so we talked about carpal tunnel and the other type, the thoracic. So massage therapy for these types of conditions are the most non-invasive, cost-effective and long-term treatment for carpal tunnel syndrome. So massage therapy is going to address the inflammation, the pain and numbness by softening and lengthening the muscles of the fascia of the neck, shoulder, upper arms, elbows, forearms, wrist, and hand. All of the places where you're experiencing the impingement are going to be massaged. Now, these areas where you're experiencing impingement. So it'll also be helpful to work the pectorals and also the rotation of the shoulders. So massage therapists are going to be able to get down in those areas and really help you experience relief for these conditions. So these sessions will be 60 to 90 minutes and may specifically be for the neck, shoulder, or arm to address the carpal tunnel. Many people will experience relief after the first session, but typically it takes 4 to 6 sessions for carpal tunnel patients to experience relief. This will just depend on the severity, the length of time of the symptoms, and it should be noted that feeling relief of your symptoms doesn't mean that the condition is completely cured. So you want to stay consistent with your care plan and continue to receive treatment. So our body posture and repetitive behaviors are the main cause of carpal tunnel and thoracic outlet syndrome. So modifications in your daily routines can help prevent future issues. Be sure to consult your doctor before starting any type of exercise or therapy program, and we would love to help you out in this process as well. Modoma has many different services, including fitness professionals that can help lead you through each of these steps to wellness. So some tips to get started is avoid keeping your wrist in the same position for 30 minutes at a time. So that means if you're constantly on the computer, you've got to take a break, roll your wrists, shake them out, do whatever you need to do. Move your entire body as much as you can when you're working. We suggest every 30 minutes to an hour, get up, move around, walk around your office a few times. Avoid slouching. It strains the neck and shoulders, affecting your wrist and your hands. You want to stretch your pectoral muscles several times a day by grasping your wrists behind your back and stretching and pulling for 30 to 60 seconds. This is really going to help those conditions. So you can also do deep shoulder shrugs by bringing your shoulders up to your ears and rolling. This does more than you know. Just bringing them up to your ears and then putting them back down helps a lot. Massage your own arms, hands, fingers, wrists to improve circulation. Don't let one hand overcompensate for the other. Try and use them evenly. I know that's hard when we favor one hand over the other, but if you're right-handed, try doing more with your left hand. If you're left-handed, try doing more with your right as well. Maintain correct posture, even sitting at your desk. Keeping your arms level with the keyboard is going to be a really great way you can experience relief as well. Avoid bending your wrists, so especially like this, and performing repetitive motions over long periods of time. Again, it's just moving around and keeping things fluid. If you want to wear a wrist splint while typing, this can ensure that your wrists remain level and relieve pressure on that median nerve. Getting regular massages is probably the best way to help this condition. You can visit modomamassage.com to get started with your introductory massage package. We would love to help you out. We have a great program for not only your pain relief, but your holistic wellness that will optimize your life in ways that you probably can't even imagine. If you have been a long-term sufferer of carpal tunnel, if you have been a long-term sufferer of any type of chronic pain, getting involved with Modoma and visiting modomamassage.com can really be a game changer in your health. So thanks so much for tuning in, and you guys have a wonderful rest of your day.